Hello children, my name is Dr. Ghaffar Ali. I am ENT doctor. It means I am the doctor specialized in ear, nose and throat diseases. First let me wear the mask. Today I want to show you what are the things we do and some of the examples removed. This is called a head mirror. We put this on the head and we examine. We will tell the kids to open their mouth and examine. I will show you in detail about the other things. As you know, this telephone or PC, printer, everyone will have. And this is our specialized ENT machine. In this specialized ENT machine, here I am going to switch the button. If I switch on, you can see whatever doctor is doing in this TV. For example, if the patient is sitting here, and if I am seeing inside his ears, nose or throat, I can see this in this TV. This light is there for the better visualization, seeing inside the throat. This machine, it sucks out. If someone is having any dirt in the ear or in the nose, I'll connect it with the suction and I'll suck it. These three things are hot and cold air things for testing the ear. There are drains, our common instruments, and this we have a specialized machine. With the help of this, we wash the ear so that all the dirt from the ear it comes out, particularly the wax. And also we have this light when we are doing a small surgeries here, then I switch on this light and do the surgeries with that. And we have so many different instrument trays. Children, as you know, it is the corona time. We always keep our room clean and tidy. Any instruments, we clean it with the specialized instrument called autoclave machine. In the autoclave machine, it will be packed, it will be kept. These are the instruments to check the nose. These are the instruments for sucking, removing if there is any fish bone, anything is stuck inside some of the kids' throat. And this is the mirror to see the throat, and these are dustbins. And I would like to show you even with one of the patients sitting here and examining stuff. Okay children, today let us learn how I examine, how I see ear, the nose and the throat with our ENT machine. Please give me the endoscope, switch on the machine. Okay, see, machine is off. You can see the picture there. First let us see the ear. So I will put this camera endoscope into the ear. See, his ears are dirty. देखो उधर, आपका काम देखो उधर टीवी में. See, ears are dirty. This is called wax. Impacted salmon, dirty. Okay. I will check his one more ear. Let us see. Oh, this is also dirty. So I will check now the nose and throat. That after that I will check how I clean the ear also. Okay. So मास्क निकालो आपका, नाक में चेक करेगा. हाँ? Okay. Now see like this. You can see there is a little bit dirty inside the nose also. मुंह खोल के सांस ले लो. Take wear the gloves. मुंह खोल के सांस ले लो. आ करो. Yeah. Now let us see the picture of throat. आ करो. आ करके आवाज करो. आ करके आवाज. Okay. Take the gauze. Gauze. Yeah. Clean the camera here. Okay. एक और बार. It was fogging, so I will do it once again. आ करके आवाज करो. आ. Yes. You can see the children. This is the throat. Here comes tonsils. For him, tonsils are not big. So no problem. But for some other children, those who constantly eat the dirty cool drinks, ice cream and all, they will get a big swelling. That is called tonsil. Okay, stop the video. Hello children. Today I want to tell you about how the wax, the dirt is formed inside your ears. Okay, so wax is something, a normal thing. Every kid, every adult, every big person, every small kid will have. So just like we sweat on our skin whenever we are running, going out, or we go to the sun, like that, these similar glands are there inside the ears. So they secrete the wax, and wax, which is something important to us, if it is there in a small amount, what it does, if anything goes out from outside, any insect, any pencils, anything goes, it will trap it so that it will not damage our eardrum. What will happen if there is no wax? Things can go directly and it can damage your eardrum. And also, like, we need not clean our ears every day with the earbud, cotton bud, or pin, or safety pin, something, and keep on scratching it. Why? Because our ear has got self-cleansing mechanism. What does it means? See, the wax is secreted inside our ear, only the outer part, not deep inside. So this wax, along with the dust or dirt, whatever is collected in the ear, whenever you make a movement of the jaw, or if you are eating, it will come out by itself. And also our ear has got special cleansing mechanism which will clean everything from inside to outside. What will happen if you put earbuds? These earbuds will push that wax deep into that, and then the wax will go to the eardrum, and deep inside it will get impacted. When the new wax is getting secreted, what will happen? It will again cover that, and more impaction will occur. Then child will not hear, even in the Zoom classes, nor in the school, or even if the parents or grandparents calling them, they will not hear. Their hearing is decreased. So almost up to 30% hearing can be decreased only because of the wax. That time what we should do? Go to your nearest ENT doctor. Doctor will check up and remove the wax. And some kids are having very less wax compared to the other kids. Why? Because some of the kids' ear canal, the tube in the ear is very small, and for some kids, sometimes if there is any growth, any bones, swelling is there inside the ear, or some kids, those who are sweating more, they may secrete more wax inside the ear. In those cases, what we should do? Almost every 1 year or 6 months, go to the ENT doctor just to clean it, it will go. So if the doctor cleans how many times, no problem. But if you are using a safety pin or earbud, anything, and putting inside, scratching inside, it is harmful for your ears. If there is a damage to your eardrum which is there inside, that is important for the hearing, then you will have hearing loss. So what we should do? Always try to, after taking a bath every day, tell a mama, the clean cotton bud, clean only the outside the ear, not deep inside the ear. Okay, only outside the ear the wax is there. Don't push inside the ear. Some kids may have big tonsil swelling inside their throat, or some kids while sleeping they may make too much noise. snoring. Those kids, sometimes they may have a condition called adenoids. Adenoids are actually normal things which are there backside of the nose, but when the kids are having an allergy, or sometimes when they are eating too much of ice creams or cold drinks or Pepsis, colas, these adenoids, even the tonsils may get big, and that time you will have a sound. And if your ice cream or colas are dirty, you can even get infections like a big tonsils with too much fever. Then you have to go to the doctor, to the emergency, then take a treatment, tonics, injections, like that. So what I am advising is, eat only the clean things. If some kids are allergic to the cold, or if they are sensitive to the cold, don't drink cold water. Some kids are fine with the ice cream also, but the ice cream should be clean and packed one, not eating in front of everyone and sneezing over it and again eating. Okay.
Justin had an awesome weekend. Now that it's Monday morning, he's taking the good vibes into the office and surprising his work pals with donuts. Problem is, tasty treats aren't the only thing he's about to share. Justin doesn't know it, but he picked up a germ at a concert last week. Now he's sprinkled his donut box, his hands, and the office door with those germs. In real time, as Justin says good morning to John, and Ashley grabs her favorite Boston cream, those germs have hitched a ride onto two new hosts. With a rub of the eyes and a gulp, they're through the human front door and ready to get down to the business of making people sick. A little later, George comes with the mail. Justin offers him a donut, and with a tickle in his throat, turns his head to cough. Justin says bye to George and leaves more germs behind. George starts making his deliveries, and as you can see, there's no return to sender on Justin's leave behind. All it takes is a touch of the germy mail, and then a touch of the mouth, nose, or eyes for a person to become infected. When it's time to call it a day, Ashley brings the infection onto the train. She hasn't washed her hands in hours. The germs covering them make a pit stop on the grab bar before finding a home on some new hands. A few cars over, Justin is coughing again. In these tight quarters, that's bad news. He and his fellow passengers get off the train and head to their homes. The spread continues. But what if Justin's morning had gone more like this? A sneeze into the elbow, and then some hand sanitizer to be safe, a cough into a tissue, and a good job throwing it away and washing hands. Coworkers don't touch their eyes, noses, or mouths, no matter what. By following those steps, Justin's germs could have stayed away and slowed the pace of the spread.